Good morning, everyone, and thank you all for being here this morning. Although many of us would have preferred to have this meeting in person, I'm very thankful we have virtual platforms like this to fall back on. My name is Dr. Mitchell Tepper, and I'm honored to serve as the president of the United Spinal Association of Georgia and also as a community relations specialist for the Spinal Cord Injury Law Firm, our lead sponsor for this important event. As we gather today, we acknowledge the pressing issue of gun violence that permeates our communities, impacting countless lives. I know this group knows the statistics are staggering and the stories we hear are heartbreaking, but today we come together not just to mourn the consequences of gun violence, but to shine a light on the long-term costs that often go unnoticed, the emotional, financial, and social burdens that survivors and their families endure long after the wound has healed. Our meeting today includes a diverse group of stakeholders, including esteemed representatives from the Ivy program and the Circle of Safety, Emory University, Grady Hospital, Morehouse School of Medicine, Moms Demand Action, Shepherd Center, Paralyzed from Violence, the Georgia General Assembly, the Jesse Parker Williams Foundation, Ghost Gaming, Accessible Suites, another one of our sponsors, and many other community-based organizations. If you or your organization was not mentioned, please feel free to introduce yourself in the chat. Each of you plays a vital role in addressing this complex issue, and I'm grateful for your presence and commitment. The purpose of this meeting extends beyond mere discussion. It's about fostering a meaningful dialogue. We aim to provide a platform for our survivors of gun violence, their families, and caregivers to share their experiences. It's imperative that we listen to their voices, understand their challenges, and learn from their resilience. Today, we delve into the unique challenges faced by individuals with spinal cord injuries resulting from gun violence. As someone who has witnessed firsthand the profound impact of these injuries, I can attest to the long-term medical rehabilitation and psychological costs that survivors endure. It's our responsibility to not only recognize these challenges, but to work collaboratively toward solutions that can alleviate these burdens. In our panels and discussions, we will explore the ripple effects of gun violence on families and communities. We will hear from families directly affected by these tragedies and examine the emotional trauma and financial struggles they face. It's crucial that we strengthen our support systems for these families and ensure they are not left to navigate this journey alone. One of the key objectives of our meeting is to explore innovative strategies to support survivors, including the potential for policy changes that can enhance reimbursement for peer specialists and community health workers. These individuals play a vital role in the recovery process, providing essential support and guidance to those who have experienced trauma. We will also discuss the long-term cost of care and the importance of employment and housing for survivors. Addressing these issues is not just about providing immediate assistance, it's about empowering survivors to rebuild their lives and regain independence. I encourage all of you to engage actively in today's discussions, share your insights, and collaborate on actionable recommendations that lead to real change. Together, we have the power to make a difference and advocate for survivors of gun violence and their families. I want to extend my gratitude to our distinguished panelists, our sponsors, and everyone involved in making this event possible. I want to give special recognition to Dr. Jasmine Clark, State Representative for Georgia HD 108, who you will hear from later in the program. As busy as she is, Jasmine answers my texts and emails in a flash and has provided me with invaluable strategic guidance. Special recognition is also due to Dr. Randy Smith, MD, MPH. She's founder and medical director of the Interrupting Violence in Youth and Young Adults program, which is called the Ivy program. The Ivy program has been leading the charge in creating an effective model to ameliorate the spread of gun violence and has literally opened the door to allow one of our peer mentors, Eddie Smith, who you will hear from shortly, to visit gunshot survivors at Grady who were paralyzed by violence. Your dedication to this cause is inspiring, and I look forward to the conversations we will have today. Let us move forward with compassion, understanding, and a shared commitment to tackling the long tail costs of gun violence. And now I turn the program over to Dr. Randy Smith to share a few words about the Ivy Project.
Thank you so much, Mitch. I'm happy to be here to represent the Ivy Project and to support United Spinal Association in this stakeholder meeting. As you mentioned, the Ivy Project is a hospital-based violence intervention program that we have at Grady. And we see individuals who have been injured by gun violence who are between the ages of 14 and 34. These are young people. These are our youth. They are young adults. And we really just want to provide them with love, support, and wraparound services so that we don't see them again coming through our doors as repeat victims of violence or perpetrators of violence. We've been very happy with the ecosystem that we've been developing, where we've really engaged with many stakeholders that are on this call. We recognize that, we are kind of the first stop a lot of times when people are injured. And if we start services in the hospital, we need our community and we need our network to continue the work that we began. We've been very happy with the bedside response from our amazing violence intervention specialist and our adjacent programs like the Trauma Recovery Center that provides mental health resources for our patients. We have an outpatient clinic where we see people who have been discharged from the hospital. And then the Circle of Safety. The Circle of Safety, I feel, is just an amazing representation of what we're able to accomplish when we work together as one unit rather than as silos. We've been able to convene 50 to 60 community-based organizations, stakeholders, and individuals from other sectors who are engaged in violence reduction work. And together we're moving the needle. Our violent crimes are down, our re-injuries are really negligible. But for us, even one person who's re-injured is one too many. So the work continues. And I know we wanted to be in person, to fellowship together, to really talk through strategies about ways that we can continue to forge ahead. But I think that this virtual meeting is just a testament to our flexibility, our collective adaptability, and our resilience. So I just want to welcome everybody. I know today is going to be exciting. It's going to be inspirational and informative. And I hope that we can just engage as much as possible on this call so that together we can continue to move the needle and to really support our communities and promote healing and well-being. So thank you so much for the opportunity.